Welcome, everyone. I'm Michelle Leifer. I'm the director of the USDAN Institute for Animal Health Education at the Schwarzman Animal Medical Center. Along with my colleague, Kimberly Young, I'd like to thank you for joining us for tonight's event, Dental Care Basics with Dr. Ada To. Tonight's event will be recorded and we'll send out a link tomorrow in case you miss anything or would like to share it with a friend. We'll be taking questions via the chat box, and we'll be sure to save some time at the end of the presentation to answer as many as possible. I'd just like to let everyone know about an upcoming event. Wednesday, March 15th at 6 p.m., Dr. Carl Toborowski, Senior Veterinarian in Cardiology at Schwarzman AMC, will join us to discuss congenital heart disease. You can register for that event on our website at amcny.org/events. We'll also have that link in our newsletter that goes out tomorrow night. And now I am excited to introduce tonight's featured speaker. Dr. Ada To is a resident veterinarian in dentistry and oral surgery at Schwarzman AMC. Dr. To earned her Doctor of Veterinary Medicine degree from the Ohio State University College of Veterinary Medicine. Afterwards, she completed an internship in small animal medicine and surgery at Blue Pearl in New York City before joining AMC's very busy dentistry service. And she was running up from an appointment to be here. So we're very grateful to have her here with us to lead tonight's event. Please join me in welcoming Dr. Ada To.
Hi, thank you so much for that introduction. This month is Pet Dental Health Month. It's very important to everyone who has pets, cats, and dogs at home. And so I'm going to start my presentation. Just give me 1 second. And so today we're going to go over some dental care basics and strategies of protecting your oral hygiene of your pets at home. And so I listed some goals for today's presentation. We're going to go over some relevant oral anatomy that's related to the overall dental health in your dogs and cats. We're going to clarify and specify what we actually mean when we say dental disease. And then we're going to talk about some at-home dental care and techniques to do so in order to allow good prevention at home. And also we're going to overview some dental care products on the market that you could use as well. A little outline in the beginning, we're going to start talking about dental disease, or AKA periodontal disease in dogs and cats. We're going to go over the anatomy of the periodontium that is related to that. We're going to lead into feline tooth resorption, another type of dental disease that is very important to recognize and know in the veterinary field and at home. And then again, going home over dental care, the techniques, and the products in the end. And so we'll start with periodontal disease. And so what does dental disease mean? And as I've said it multiple times, it means periodontal disease, but what exactly does that mean? And so it is overall a pathologic process of leading to progressive attachment loss around your tooth, and through periods where it's very active, or what we call periodontitis of the inflammation of your gum disease, or periods of quiescence or quiet. So overall, dental disease equals gum disease in dogs, but it does play an important role in how the teeth are impacted. It is usually a process that starts underneath the gum line, so you won't necessarily see it. And when you do see it, it is at a stage where there is professional intervention needed. Just a fun fact, I know in humans, we always talk about, oh, we get a lot of cavities. Does that happen in dogs and cats? Rarely do we ever see that occurrence. So dental disease does not necessarily mean cavities in dogs and cats. In one study, in about 400-ish dogs, only 5% of the population had it. So it's a very rare occurrence that we usually see when we are professionally evaluating them. Next, we're going to talk about the prevalence of periodontal disease in dogs and cats. And in a review of literature, when overall population of the feline and canine population, about 80 to 85% of them are affected by this disease, which is a huge, huge number. Usually you'll start seeing it around 2 to 3 years of age in both species. But we have seen some with younger, some younger cases as well, but not as commonly. Next, we're going to go over some basic anatomy of the tooth. And so there are some important structures of the tooth that we'll go over briefly. So hard tissues of the tooth, starting with your dentin. So your dentin is that inner portion of the tooth, as you can see, if you can see my clicker arrow here and this guideline here, and that's the inner portion of your tooth that is going to start from your crown and all the way down into the root. The enamel is the hardest part of that hard tissue of the tooth, and it kind of outlines your dentinal structure there, and it usually covers what we call the crown of the tooth, or the visible portion of the tooth that you could see. The cementum is the extension of your enamel, another hard part of the structure of the tooth, and that extends down into your root, and it's something you don't see clinically or something you can see at home. So those three are your hard tissues of the tooth. Then you also have your pulp cavity, similar to us, where it contains your nerves, your roots, your blood vessels, some fibers, connective tissue, and also odontoblasts, which are cells that continually grow that dentin or that hard tissue of the tooth, and makes that kind of pulp cavity even more narrow. And so the next thing that's very important that is related to what periodontal disease is your periodontium. So when we talk about that disease, it incorporates these structures, and there are 4 parts to these structures. So the gingiva, or your gum tissue, basically, your periodontal ligament, so gingiva is right here, your periodontal ligament, which is something, again, you can't see clinically. It is down in your root, and it's this structure here. Usually there are fibers that connect that root to the surrounding bone there as well. It is also the cementum that we talked about, that hard tissue down in the root is incorporated, and also your alveolar bone, which is the bone that holds the tooth in and that socket in. And so those 4 parts create your periodontium. The function of that periodontium is to anchor your tooth, to cleanse and protect the tooth, and also serve as a sensory tissue. So periodontal disease, we're going to go about talking about etiology and pathophysiology. So periodontitis, as I've said before, it is the active inflammation of your periodontium that we discussed prior, of those 4 parts. And it is all because, why is this all happening? It's because of that plaque biofilm made from the bacteria in your mouth. And so how it starts, and in this picture, it's a great description that I found, but it starts with a very tiny product called a dental pellicle, or substance. And so that dental pellicle is about millimeters big, and it's made of what we call salivary glycoproteins that come from the saliva of dogs and cats, and it happens within seconds. And then within hours, the bacteria in the mouth, the bacteria that can survive in an oxygen-dependent environment, will colonize that dental pellicle, and then that plaque biofilm will be established in about 24 hours. So that plaque and tartar buildup goes really quickly. And then in 48 to 72 hours later, you're going to see a lot of calculus and tartar buildup. So the plaque becomes something even more visible to the naked eye, of that gross yellow or brown substance that's stuck to the teeth. And it happens within 48 to 72 hours afterwards. And some components of that are calcium carbonate, calcium phosphate, magnesium, sodium, potassium, etc. So your pellicle is right here, and then this is your plaque biofilm, if you can see my arrow again, building up upon creating your plaque and tartar and calculus. So next, we're going to talk about the plaque. So what exactly is plaque made of? So plaque is your organic matrix of salivary glycoproteins, the bacteria we talked about, molecular fatty deposits called lipids, cellular debris, extracellular polysaccharides, so substances like from carbohydrates, food, etc., and that all adhere to the teeth. The glycoproteins and those polysaccharides allow for those adherent bacteria to form onto the plaque, And contrary to popular belief, we always think, oh, the food is the main worry and cause of why the plaque accumulation and bacterial accumulation are happening in the mouth. But it's actually when it's accumulating more when you're sleeping. So actually when you're eating food, it is that mechanical action of biting down and eating that food for your dogs and cats that will stimulate their saliva production and then actually deter the plaque formation. So, and that will play a role later on in this lecture. And the biofilm is terrible because it's going to prevent any antibiotic use. It's not going to be penetrable per se. It's going to remove the moisture in the mouth and the saliva, and it will limit the host's immune response. So more consequences of plaque. So it starts off in the crown. So something you can see, all that plaque, that thin layer turns into a thick layer. And then eventually it will lead down into the pocket between the teeth and the gum. So this is a great picture on the slide. So all that plaque and tartar is going in this pocket, which is something you can't reach at home per se. The biofilm from that top tartar will basically close this portion of between the tooth and the gums and close off that pocket. And eventually bacteria that don't need to have oxygen will grow in that environment because all the oxygen is sealed off because of the plaque and tartar. And it will lead to making products like ammonia, sulfur compounds, and enzymes that will lead to the destruction of all those periodontium layers we talked about. So your gum tissue is affected, the bone is affected, those ligaments are affected, and that hard enamel surface in the root is going to be affected. And also when you're thinking, oh, why does my dog or cat have bad breath? It's making these sulfur and ammonia compounds, and that attributes to their stinky breath. Also at the same time, they're also making an inflammatory and immune response leading to tissue damage and bone resorption. Other changes that you can see clinically, gingivitis first starts, and it's the inflammation of the gums. So on the picture here, you'd see inflamed gum. There's no pocket formation yet. So that's the first step in terms of periodontal disease that you will see. It is usually reversible if you get to treatment in time and in terms of professional cleaning, or if you're doing diligent at-home care. And you usually see within 2 to 4 days after the tartar and the calculus is formed. Periodontitis is when it leads to your pocket formation and periodontal ligament detachment. It usually is non-reversible. There are exceptions for treatment in which we can try to reverse it, called guided tissue regeneration, and we'll get into that a little bit later. And usually it will progress about 1 to 3 weeks from when you see gingivitis if nothing is addressed. And on this picture, really good picture, you see the gums are receding, the tartar is still present in between that pocket, which is hard to get to, and your bone loss, there's some bone loss there compared to the left side. Next, we're going to go over some cofactors in terms of how and when this periodontal disease is going to happen. So small breed dogs, toy breed dogs, and purebred breeds, either cat or dog, are more likely to get this disease. So some examples are miniature schnauzers, Maltese, sighthounds, so the small Italian greyhounds, some whippets, and even the big greyhounds, cats, purebreds like Abyssinians, Somalis, Persians, and Burmese. We see a lot of domestic short hairs as well with this. So it's not limited to only these breeds per se. I will say as a side note, large breed dogs don't tend to get periodontal disease. They just have a better kind of mechanical motion when chewing dry food. Maybe it's their genetics, but because they're chewing so much on certain things, sometimes they're more likely to break teeth. And that's another topic for another day. Dental abnormalities lead to increased risk of periodontal disease. So crowded teeth leads to more plaque accumulation. Malocclusions if the jaw wasn't born correctly, if they have an underbite, overbite, and persistent deciduous teeth, which in this picture we had a really cute dog, a young breed, young age dog, and you can see that the deciduous teeth is that tooth right behind the smaller canine, and it's creating a lot of that plaque and calculus buildup there. Genetics also play a role sometimes. Systemic health and altered immune responses can lead to more oral issues. And diabetes, so examples are diabetes mellitus can cause more oral inflammation in certain ways. Sometimes it can even lead to insulin resistance in certain species, in certain instances. I've yet to see that in my professional experience so far. And immunosuppressed patients, they just don't heal as appropriately. If they're older, for sure. If they have any abnormal chewing behavior, so wearing or what we call abrasion of the teeth, a wearing down of the teeth. And nutrition doesn't play a big role, not necessarily what's put in it, like the protein or the grain, etc. But if it is a soft food versus a hard food, and again, we'll get into that a little bit later. So consequences of periodontal disease on overall systemic health. So as we talked about before, it is a bidirectional relationship, or as I was alluding to before. So oral disease can lead to systemic disease and vice versa. In human medicine, periodontal disease can lead, that inflammation and infection can technically lead to cardiovascular disease, other systemic inflammatory diseases, neurologic disease, cerebrovascular and pulmonary diseases. Sometimes there are male reproductive changes, and also in humans, lower birth weights and also premature births. In veterinary medicine, there have been changes found that where there are distant organ changes to the kidney, liver, and heart, there's that systemic inflammation still, and that bacteremia seen with periodontal disease in dogs and cats. However, despite having some studies shown a connection, we cannot fully really dependably say that there's a direct causal relationship from systemic disease because of the dental or periodontal disease in the mouth. And I know a lot of owners are worried about their dogs and cats with heart disease. Inflammation of the heart or infection of the heart called endocarditis is rarely seen in most studies. I don't have the number off the top of my head, but it has not been commonly seen. So I know a lot of people are worried about that. So what happens if the periodontal disease goes unchecked? What are the local consequences? So on this picture to the right, this describes what we call a pathologic jaw fracture. So that disease, if left unchecked, can rip through your ligament and can literally rip through the jaw. And so some dogs that have no history of trauma just come in because the dental disease is just so bad. And this tooth, just all that ligament, all that bone has worn away and led to the jaw fracture. You could also see oral nasal and oral antral fistulas. So that means that tooth, maybe it's fallen out. There's a persistent hole in the upper jaw or maxilla, and it's connecting into either the nasal cavity or that upper jaw and what we call a maxillary sinus, which is not great. Mobile teeth and tooth loss. Sometimes you'll see wiggly teeth or you'll see tooth fall on the floor. And then the biggest thing we always see it for is tooth root abscesses, which are basically pus accumulations at the root, infection at the root of the tooth. And you can see it as facial swelling, ocular discharge, and bloody to mucoid nasal discharge as well, along with some sneezing. Now that I talked about some clinical signs, what are more clinical signs of periodontal disease? And I will say as a caveat overall, dogs and cats are really, really good at hiding their clinical signs. So I wouldn't feel too bad if you didn't catch it way in the beginning when the periodontal disease has just started. It's really hard, and we acknowledge that. But some signs are bad breath, that inflammation of the gums you saw, that plaque and tartar we talked about on the crowns of the teeth that you could see, reluctance to chew on certain sides, to even pain on certain parts of the oral cavity when you're palpating it. They're head shy, they don't want to be pet, they're pawing at their mouths, they're dropping food, sneezing or having nasal discharge, their jaw is moving abnormally when they're eating, they don't want to eat hard food as much, or they're drooling a lot, and sometimes the draining tracts in terms of openings of the pus, either in the most likely in the upper jaw that you can see from tooth root abscesses. And again, another caveat, decreased appetite and drinking. Yes, dental disease can totally have these clinical signs, but rarely, if it's been present for a long time, rarely it is the primary reason why your dog or cat isn't eating. So we would always like to make sure their whole body and their whole health is checked out and make sure there's nothing else going on like kidney disease. Because again, as we talked about before, it is a very waxing and waning process. So sometimes you will see that they are painful. They need intervention with medications like pain medications or antibiotics. And then 2 weeks later, they're totally fine and normal again. So I would really take decreased appetite and drinking with a grain of salt. So what do you do once you know there's periodontal disease? How do we treat it? And we treat it with professional dental care. So that's where we come in as a dentistry service. So we call them COHATs, or complete oral health assessments and treatments. And general anesthesia is mandatory, and we'll get into anesthesia free in a little bit, but we need them to be fully under anesthesia to have that correct assessment and plan their treatment appropriately. We do a full set of radiographs or x-rays in the mouth, which cannot happen if they are awake and or barely sedated. And we chart all the teeth in the periodontium. We do periodontal treatment, and what we mean by that is scaling and polishing the teeth. And then if there's any more intervention needed, like dental extractions per se, we do so. And then a lot of people will always ask, how often should we do these anesthetized procedures? So frequency, I will say, and we've discussed this as a service, is very individually variable. And that seems like a very ambiguous answer. But again, every patient is going to be different. There are some patients that have terrible dental disease, like I have to go once a year as a human. I have bad dental disease, but there are some that have to come every year. Some have to come, every 6 months. And some, like the large breed dogs, will only have to do this every 2 to 3 years. So it really depends. Next, we're going to talk about anesthesia-free dentistry, and this is a very grinding topic. I know there are places out there that may still offer this, but by the College of the American Veterinary Dental College, and they have a statement about it, we do not recommend it. The sedation or even no sedation, you're not going to get good evaluation of what's underneath the gums. And I bring this picture up again, like all that tartar, all that bacteria, they're never going to clean it out on a awake exam or sedated exam. If they have anesthesia-free dentistry, you can bring trauma not only to them as you're evaluating and treating them, but you can also there's also trauma to the veterinarian that is taking care of them, or the veterinary technicians. We would minimize pain stimulus if we did the anesthesia. Without it, they may be more painful because there's no way to control while they're sleeping. They're basically half awake all the time. You're going to miss that disease we talked about. And even though it's a lower overall cost, you're getting the cheaper quality of care. So you basically pay for what you get. Incomplete oral assessment. And the biggest thing is that we do put a tube into the airway to deliver the anesthetic gas. And that not only does the anesthesia, but also protects their airway. So as you're doing the cleaning and there's water involved, where you're going to prevent a higher chance of having aspiration pneumonia. Without it, they're more likely to get it or aspirate on their own or regurgitate into their lungs. This is just an example of x-rays we take on a patient. We do a full mouth pre and post extraction if it is necessary. And this is an example of a dental cleaning. This is a young dog. It only had one extraction, but on the left side, we did the full radiographs, which we showed you before. Left side really dirty, but the right side spick and span and clean. But we did this all with the x-rays, with the charting and the probing, all while under anesthesia. And this is a complete COHAT that we recommend. So stages of periodontal disease. Normal is clinically normal, so stage 0, which is great. Stage 1, it means only gingivitis or inflammation of your gums. There's no periodontal ligament detachment loss underneath in the roots. Stage 2, you have less than 25% loss. moderate stages, 25 to 50% loss, and stage 4, the most advanced stage, you have greater than 50% loss of those root attachments holding that tooth in. Not as to mention as well as the bone structures that are holding that tooth in as well. So treatment options for periodontal disease, as we went into a lot of depth, periodontal cleaning. So everything else looks good. It's just a really dirty mouth. So we start with the chlorhexidine gluconate oral rinse, which is just a rinse, an antiseptic rinse, and we decrease the aerolization of the bacteria as we're scaling. Scaling is going to be not only on the crown, but underneath that gingiva. And we're not going down all the way into the root, just like right below that gum line, just as if you or I were to go get a dental cleaning as well. Polishing happens after every scaling, just because we want to smooth out those rough surfaces and discourage any bacteria from getting onto that tooth quicker, even though no matter what, it's going to grow back in 24 hours. And then I put Sanos there, oral sealants, which are things that we can do. So these Sanos is basically a type of sealant we put on to protect that pocket and that gingival area, to discourage any bacteria from going down into that pocket. However, efficacy of it, it says it's going to last 6 months. We're not really sure if it really lasts 6 months, and we really only utilize this for patients that we know we really truly cannot anesthetize every 2 years because they have the most severe stage of heart disease for some reason. And it is really meant for the clients who really have tried at-home dental care multiple times, and their dog is going to bite them or thrash them, or they're, like rolling around and pooping themselves. So we really hold that off for really certain special instances. Other treatments are teeth extraction or exodontics, because that tooth is non-vital and dead at that point. Open and closed root planing is something that we use a special sharp instrument called a curette, and we go right below that gingival line and scoop out more of that plaque and tartar. And then guided tissue regeneration, which is something we talked about before, is something that similar to the root planing, but the next step is that their pocket is so deep. We put a bone graft in after we clean all that out. We do cut the gingiva a little bit in hopes of regrowing that periodontium or that alveolar bone, that cementum, those periodontal ligaments. However, another caveat, you really, really have to be the type that will do at-home diligent care, daily brushing, will come back every 6 months to a year for anesthetized procedures, because if we don't do this, we're basically doing once, and it's not going to actually help regrow that periodontium at all. Another topic, antibiotics. So we talked about how that plaque biofilm is very resistant to antibiotics. And I know in certain instances of tooth root abscesses or signs of it that we will use it. So use of antibiotics to cure periodontal disease is not the point. It will not cure this dental disease. Only removal of that plaque or periodontal surgeries that we talked about, like extractions, the guided tissue regeneration, will resolve the disease. It can be considered, though, for patients when they are clinical, they're moderate to severe dental disease already, and we can't get them in any sooner for a procedure, unfortunately. So we're okay on using in that kind of situation. If they're immunocompromised, if they already had previous orthopedic implants, and or they have systemic disease that's uncontrolled for some reason. There's always a concern for antibiotic resistance when we're using it. So if we're just throwing antibiotics willy-nilly at it and not really considering doing a anesthetized procedure, it's not ideal, because at one point there may be antibiotic resistance down the road to helping your dog for maybe other issues. The next topic we're going to talk about now, and we're going to switch gears, is feline tooth resorption. And this is a nice picture. It shows that tooth is resorbing, but I will get into the processes of it. So feline tooth resorption is one of the another common disease that we see in cats. It is a painful process leading to erosion of your hard tissues we talked about before of the teeth. Eventually those hard tissues and the bony structure of the tooth will resorb into that alveolar bone or that jaw bone that basically holds that tooth. About 25 to 75% of cats are affected by the disease. I would say more 60 to 70%. There's a wide range, but in our experience right now, it's about 60 to 70%. It is a progressive disease causing the root resorption. So it starts exactly in the root. So you won't necessarily see it in the beginning. It can lead to crown fractures because eventually it will creep up towards the crown to the point where you can see the erosion in the lesion. And it can even lead to open wounds in the mouth because that root is resorbing in the jaw. At least 33% of these cats will somehow develop tooth resorption in their lives, and that likelihood will increase in age. Usually we start to see it around 4 to 6 years of age. And overall, why does this happen? We have no idea, unfortunately. We have a lot of suspicions, and there are studies out there that are in processes, but there's no slam dunk clear study to say this is the cause. Some suspicions are viral causes such as feline herpes, feline herpes, feline leukemia virus, feline immunodeficiency virus, but nothing slam dunk about them just yet. Sometimes genetics plays a role again, we just don't know. So Dr. Martel wanted me to put that out there. If anyone is interested in funding a research about finding the cause of feline tooth resorption, let us know. We're all in for it, and we want to, help these cats out overall. Overall, feline tooth resorption, these are some examples that we've seen clinically here. So in the left picture, we have this tooth, and you can see this kind of pink, fleshy gum tissue, which is not exactly gum tissue. It is that big ulcer of that tooth, and it is painful. If you touch it, your cat won't necessarily bite you per se, but they will flinch. It's not a fun process. And on the right side, you'll see an example of an x-ray, and you can see that tooth, there's a huge chunk missing, and that's not because it's a fracture, that's because there's resorption happening in that tooth itself. So what can you do? How do we diagnose it? Similar processes as the periodontal disease. So do your COHAT or that professional evaluation under anesthesia with us. Let's do the periodontal charting for probing each tooth, checking for pockets, checking for those lesions that we talked about, doing the x-rays. On the right side, this front tooth here is another tooth that is resorbing into the bone, and treatment overall is extraction. We're going to either take off the crown and let the roots resorb into the bone, or we're going to take out the whole tooth. It really depends on what kind of resorption it is. And then the next thing, which I think everyone is very interested in and hopeful for at home, is dental care at home, and we'll get into that topic right now. So number one thing, and I know it might be very bothersome to some, but toothbrushing, that is the number one thing you can do at home for your dogs and cats. The most effective home care for plaque and gingivitis, just as we brush our teeth twice a day, toothbrushing at home for cats and dogs, very, very good. So why is it effective? You're mechanically removing that plaque biofilm. That mechanical movement is very key in removing that and preventing that periodontal disease. You usually should start before any of that disease is established. So if they're younger, if they're puppies, if they're kittens, let them get used to the toothbrush. We'll get into that shortly. And we do acknowledge that it is hard to get into certain places, especially the inner portions of the teeth, either if it's the upper or lower jaw, and also the molars all the way in the back. And that's where we come in again, where, go to your primary veterinarian first, have that oral assessment on exam, and see if they recommend an anesthetized full COHAT or dental procedure and getting the scaling or periodontal treatment and polishing done. So toothbrushing, gold standard is once a day, just as I said before, twice a day for us, once a day for them. And we recommend a soft bristled nylon toothbrush. I know there are a lot of toothbrushes on the market, but we really advise against the hard, rough bristles or even the plastic toy ones. I know there's one that looks like a plastic one and it's all plastic made. It's going to be really harsh on the gums, and we don't want the gums to be affected. You could do it at least every other day. I mean, if you could just do it at all, that'd be great. But gold standard is once a day. The technique, they say about 45 to 60 degree angle. Honestly, if you can even brush your dog or cat's teeth, the angle doesn't necessarily matter as much to me. I think a good way to do things, and I'll show you some examples coming up, is you're taking the toothbrush and you're starting from the gum line, not necessarily on the gum line, and you're kind of pressing down and sweeping, kind of like if you're just sweeping all that plaque and tartar away. We usually recommend 30 seconds per side. And so there are 4 areas of the mouth or quadrants. So your upper left and right sides, your bottom left and right sides. And if you can get the cheek aspects of the teeth, absolutely fine, that's fine. Bonus points if you can get the insides of the teeth too. Application of toothbrushing, again, talking about desensitization, especially when they're a younger age, they're more likely to get used to it, but doesn't mean an older dog or cat can get used to it too. Positive reinforcement, giving them treats. Hey, you lick this toothbrush, here's another treat. So giving that reinforcement that way to make it a happy experience, and just having that consistent routine down pat is very important. So if the other thing, the aspect is if you're a dog or cat and you're just wanting to start toothbrushing, which is totally fine, it's actually awesome, but they're older, they already have dental disease and they have moderate to severe tartar and gingivitis already. Honestly, it'd be better to start from square one by doing an anesthetized cohat dental procedure, get it back to square one, get it all clean, and then starting this toothbrushing again. So now I have some examples of some dog toothbrushing. This is a really good patient. He's a large breed dog. His name's Sunny. Let me just see how they. And so this is me. I'm just getting to the inside portions of the teeth, and I'll go over what kind of toothbrush I'm using in just a bit. And I'm just holding up the lips. It's not necessarily a 45, 60 degree angle. The back and forth motion is totally fine. You could do the sweeping motion too. Honestly, however you want to do it. There we go. So brushing, we're brushing some more. Really that back and forth moment and motion is really good and key. And then we're just lifting, parting the lips, just to get that. And the same thing with the incisors. He doesn't have any incisors or very few. So this is just an example of what you would do. So let's stop. And there's one more. I could. And so another technique I like, especially if you have a small breed dog, again, it's hard because he's a larger dog, is closing the mouth and muzzle. They don't necessarily need to be open, especially if you're aiming for their cheek teeth or cheek portions of the teeth. You can close their mouths and just kind of brush in that aspect, and they usually can tolerate it a little bit better. And now also we have an example for a cat. This is the resident prior to me, and this is his cat Finnegan brushing his teeth, and this is on the YouTube video website too. But step one, he's introducing that toothpaste, getting him used to it. So desensitization, if you're just starting off as well, then you're going to swipe that toothpaste inside the corners of the mouth and get them even more used to it, and get that motion of or hands in the mouth comfortable for them, so they're not as scared when you're doing the toothbrushing. Then he's introducing that toothbrush. He's putting a little bit of toothpaste on it, and we'll go over the products in just a bit. He's licking it off totally fine. This is great. He's loving it. And then last, he's just brushing the teeth in a circular motion, you know, side to side motion, 45, 60 degree angle, the sweeping, totally fine. And aim for 30 seconds per side. And that's about it. And that's on our YouTube as well. This is a fun YouTube video that my mentor found. I don't recommend getting a bear as a pet. I don't recommend brushing bears' teeth, but this is a guy, his name is Tarzan, I think, and he's brushing his pet bear's teeth. So if he can brush his pet bear's teeth, you can brush your dog and cat's teeth at home too. And so now products we're going to go over a little bit. So toothbrush recommendations, what do we recommend? Oops. So we've been using a lot of what we call the Nimbus or NIMBY kit toothbrushes. They are human products, but we've been really, really liking them. The bristles are very soft and fine. They have long and short ones to brush the crowns and also the gums really well. They're really, really good on the gums. We've been using it on our teeth. Everyone in our department has been loving it. But get the kid size because the human size is the adult size is a little bit too big, even for the large breed dogs. The soft bristles will maintain that periodontal health, and it was recommended by a human periodontologist that came to our veterinary dental conference last year, so we've been loving it. Toothpaste recommendations. I really like the CET enzymatic toothpaste, and it contains a chemical additive called glucose oxidase and lactoperoxidase. It is that enzyme component, so when it's used on that toothbrush, it combines with the oxygen and water in the saliva and creates this compound called hypothiocyanate, which is a naturally occurring antimicrobial agent, which is great. I don't recommend using human toothpaste because they have fluoride in it, and fluoride, when used in a large amount of quantities over time, can be toxic to our animals, so don't recommend that. And what to avoid next in dental treats. We would avoid anything that's really hard for our dogs and cats. So hooves, bones, ice cubes, antlers, like deer antlers, tennis balls, not because it's hard, because those fibers can create that wear and tear on the teeth that will lead to the periodontal disease and bacteria seeping in even more. Hard plastic toys, and anything else that can lead to tooth fractures that lead to infection or inflammation of the pulp, creating what we call endodontal disease or disease inside the tooth, as well as that can lead to periodontal disease as well. So the rule of thumb we have is anything that you can break your teeth on, don't give it to them as well. So a little bit about dental diets and treats now. They are a good second line tier of dental care at home adjuncts, but teeth brushing is number one here. So again, it's that mechanical motion of the chewing on the tooth that allow that plaque and calculus to really fall off and be removed. Again, you cannot replace toothbrushing. That's gold standard. And it's been shown in studies that toothbrushing is 3 times more effective than dental treats or diets. And between the treats and diets, there's not one or more that's more effective. They're basically similar efficacy in a way. However, I would say if you do the dental diets and treats, really watch them in the beginning and the first 1 or 2 weeks, because if they're not chewing it, they're just swallowing the treats, which I know some patients do, they're not going to be effective because they're not having that mechanical motion. And the diets and treats are effective because they're formulated in a way in terms of the larger size, their shape, the abrasiveness of the fiber composition, the texture, and that formation really allows that effective dental care. Some diets, like prescription diets, such as Royal Canin or Hills, and I'll show you some pictures next, they have a component called polyphosphate, which allows for that to control that calculus accumulation. And that's because they bind that component called calcium carbonate in the saliva. There's always a concern, no matter what treat or diet, that there's going to be some gastrointestinal upset, if it will become an esophageal foreign body, gets stuck in the esophagus. And, we have to be very careful about their weight gain, because they have calories associated with it. And if they're on a weight loss diet, you kind of have to talk to your veterinarian about it. The Veterinary Oral Health Council is a great resource. They go over all these products, tools, the gels, the toothpaste, the diets, the treats, and they have a website that has the list for dogs and cats. They are members of the American Veterinary Dental College. They review all the research that the product companies send to them to make sure it is the efficacy they promise. And they have these seals that have plaque and tartar control labels on them. So recommendations for more treats, toys, and diets. Royal Canin Dental makes a great one for cats, small breed dogs, large breed dogs. Dental Care TD is another company as well from Hills. I will say if your cat or dog is already on a prescription diet for something else like kidney disease, I wouldn't be pushing so hard to switch to it. It's still that mechanical motion of a hard food. The soft food, yes, may lead to more dental disease, but kidneys come first in certain instances. And we've been told by Royal Canin that the urinary SO diet for cats and dogs actually have that compound, that polyphosphate compound that helps decrease the calculus in the mouth. More examples. So Kong toys are great toys to work with, but they will wear out faster because of the rubber. Greenie treats are good. Oravet chews are good. Veggie Dent chews are good. These are all VOHC approved on their website. Some will remove plaque and tartar. Some will remove tartar. These are just a few examples, but you got to see if they're going to chew it or if they even like it first. Next are the healthy mouth gels or gels in general and some wipes. So these gels and wipes contain a chemical additive called zinc containing compounds called zinc ascorbate or zinc gluconate. It can control plaque. It's going to support collagen growth, and it's going to bind to those stinky sulfur compounds that make that stinky breath in your cats and dogs. They also have the ascorbic acid or vitamin C, which is an antioxidant, which also is a supplement that may or may not help with the inflammation in the mouth, but it will soften the plaque in the mouth. So it may help with brushing easier, or even when we do dental care professionally, a little bit easier. So some examples we actually really like MaxiGuard. It is cheaper than Healthy Mouth, and they contain basically very similar compounds. So MaxiGuard we love. They have a gel, they have a wipe. We really like that product. And so overall summary of our discussion, periodontal disease is one of the most common diseases seen in dogs and cats, then following feline tooth resorption in cats. But you also have to understand that periodontal disease is something that's very chronic and progressive. It's not a one stop and shop. It's only going to happen once in life. It is a continuous process because that bacteria is going to continue to grow within 24 hours, no matter what you do. And that's what doing the at-home dental care is really trying to prevent as well. So that anesthetized cohat and the at-home dental care together, monitored by frequent yearly exams, is very important with your primary veterinarian. So it is a very multimodal approach, and maintaining that multimodal approach is very key in maintaining oral hygiene. So if you can even do some oral examinations at home, like take a quick glance in your dog or cat's mouth, even better. If you really can't, no worries about that. And there are some clinical signs we talked about, but again, don't beat yourself up if you are missing it. It is very hard sometimes. Very key to have that frequent toothbrushing, plus or minus if you decide to go into adjunct oral health products and care, such as the dental diets, treats, the gels, the wipes, totally great as a full multimodal approach. And again, just to hone in that point, periodic anesthetized oral professional evaluations with professional cleaning and appropriate treatment are very key in terms of maintaining oral hygiene overall. And that's where we come in, and we're here at the Animal Medical Center. So these are some resources that you can use. The American Veterinary Dental College has a lot of good information for clients. The Veterinary Area Oral Health Council that we talked about for the products. The AVMA has good information as well for what exactly is the dental disease or tooth resorptions in cats. And then now I'm going to open the floor for questions. This is just a funny cartoon about people and dogs brushing side by side. But thank you for listening, and I'm happy to answer any questions that are out there.
Well, thank you very much for this wonderful and comprehensive presentation. If you want to unshare so we can see you a little better. And we have lots of questions, so let's get started with that. Okay, we have several people asked about cats with FIV, what you recommend for them as far as dental care.
I still think that the same goes for FIV cats. It doesn't necessarily mean that is, we can't say for sure that is the cause, but the same goes for what I recommend in the PowerPoint. So getting those yearly exams with your veterinarian, making sure there's no resorption lesions or severe gingivitis or tartar buildup. And then if there is, they will direct you to getting that anesthetized procedure. And then if you can do some at-home dental care, absolutely wonderful. I think those steps are still appropriate for FIV cats.
Okay, great. We have several questions, people asking about the name of the toothbrush. We will send out a link tomorrow. I send out an email tomorrow with this information, but I believe it's Nimbus, right? And yes. I guess where you can buy it.
So it's the Nimbus. And again, we are not sponsored by
Nimbus. I know.
Periodontal was not sponsored either. Anything from it. We just really like it. And it is, you can get it on Amazon. You can get it anywhere. It's a human product, but it's Nimbus and it's called the Nimby Kids Toothbrush. But this lecture will be uploaded and you can also find the name of it and look it up. It's on Amazon. It's about, I think, $12 for a 4-pack. So it's not super expensive.
Okay, great. What's your opinion on finger brush with the bristles?
I think so I think the most important is the bristle consistency. So if it's very rough, I don't love it. If it's very, I know there's like multi-headed toothbrushes out there but the bristles are very rough on it, kind of like a shoe brush. I don't love that. So if the bristles are really rough on it, I would avoid it, even if it's a finger toothbrush. But I know that there are some finger toothbrushes out there with pretty soft bristles. I just don't have the name off the top of my head.
Okay. That's right. I've seen there's the brushes with the like double heads, right? So you're saying that doesn't help anything or
rough.
Okay. So, okay, good.
Yeah.
Okay. We had a question about small dogs and if I guess would it be advisable or why don't we remove some teeth? I guess when they're very young, if like would that prevent periodontal disease?
So we're not going to take out healthy teeth if it's not indicated. When we take out teeth, it will still cause pain and inflammation. So it's not a very light thing to do per se. But a lot of times those teeth are non-vital or borderline non-vital. And that's when we have that discussion with you guys of what can you do at home if you can do anything at home with dental care. And so it will guide us into how we extract or do treatments for your pets.
Okay, great. And then caring for a pet who has had their teeth extracted, do you still brush? What do you do in that case?
Yeah, so usually we would wait like 10 to 14 days after if they had any extractions that day, and then administering the toothbrushing. So once a day. So the sutures are going to heal on their own. By the time of 1 week, the mouth should be fully healed. But by the time of 10 to 14 days, I think it's safe enough to administer the routine.
Okay, what about a full mouth of extractions? Do you still brush if they don't have any teeth? Yeah.
Yeah, if they have no more teeth, you don't have to worry about it.
Okay, it doesn't help.
And that's another lecture in of itself. If it's like cat, like stomatitis, which is an inflammatory immune-mediated disease, and they had full mouth extractions, there's a small population of them that will still need medical management, not with at-home dental care. That's another topic in of itself.
Okay, all right, you can come back. Maybe that'll be next year. So we can do that. So, okay, great. Let's see. Water additives, you talked about a little bit. Gauze.
Yeah, so the additives like the Healthy Mouth water or any of that, there's some water additives listed on the VOHC website as well. A lot of them are supplement based as well. So, I mean, I don't know if it's really doing much, but again, it is just a supplement. I don't necessarily think they're bad, but I don't necessarily think they are top of tier line going to prevent periodontal disease on its own. It is very good as an adjunct. And with the gauze, I'd say the gel with the gauze, again, another great adjunct, rub it on the teeth. It can get a little bit on the gums. It's going to be totally fine. I think that's okay. Okay,
great. My dog has allergies and is on a restricted diet. What dental product can I use that's unflavored or that is?
So I think I would stray away from the diets and treats then, because if your allergens are well controlled on the current diet that you have right now, I wouldn't really necessarily mess with it. brushing the teeth. Again, brush those teeth. And also using the gels out there, using the Healthy Mouth. I would say the gel won't have the extra supplements. Like I know Healthy Mouth is made with blueberries and cinnamon and things like that. So I would say maybe try to use MaxiGuard gel as an adjunct again to toothbrushing. So.
Okay, great. Okay, when giving dental treats, must size guidelines be followed? I have a medium-sized dog who's an aggressive chewer.
So I would really watch it. So no matter what size of a treat you're giving, and I know this is kind of an ambiguous answer, I would really watch them and see how they chew on it, because they may swallow it whole at one point and cause that esophageal lodgement there. It's really hard to say. I'd say if there are size guidelines out there for, oh, okay, this is the size, great, start with that, but still watch them in the beginning and see how they're eating it and seeing if there's any concerns, whether it's from the GI upset, the esophageal foreign body, and seeing if they're actually chewing it. I'd say start there.
Okay, great. Okay, this is, some dogs have brilliant white teeth while others are yellow, even with good dental care. How much of that is genetic? How much due to diet? And then are there products that whiten dog teeth?
So yeah, that yellowing, discoloration, it can range from, you know, the enamel being worn off, so that enamel is that white color that is kept on the tooth. So that yellow color is that dentin structure we talked about coming through. Genetics can play a role in it. I don't know the percentage. There's no study about it with a hard number percentage out there, but we definitely see individual differences in all our patients. And I'm sorry, what was the other part of the question? It was
to whiten the dog's teeth.
We don't bleach teeth that don't do anything for cosmetic purposes, which we don't really need in
right.
Yeah.
Okay, we have a dog who likes to chew pizzle sticks and hard cheese chews. Are they safe? Yeah, like bully sticks, I guess. Bully sticks.
I believe bully sticks are a softer consistency, so I think it's okay. But again, if there are some made out there, because I know there's some that are really, really hard, and there's some, it kind of looks like bone in some instances, I would totally avoid it. So anything that looks collagen based, like in their kneecaps, anything like that, I'd say that's fair game. That's fine.
Okay, great. And nylabone, no, right?
No to the nylabone.
Yeah.
So many German Shepherds, so many large breed dogs that crack their big upper carnasal tooth, and they're coming to us for root canals and yearly checkups and extractions, which is not, and they're like 2 years old. So.
Okay, this is a good one. How often should we replace the doggy toothbrush?
Yeah, so once the bristles are pretty worn out, I would say I would throw it away. So if you see it splaying on its sides already, I think it's time for it to go. If the bristle length is really short for some reason, it's time to go. But I say like a good rule of thumb, I would, and depending how often you brush, like every 1 to 2 months, I feel would be ideal.
Okay, great.
Yeah.
For cats with teeth resorption, after extraction of a bad tooth, do the chances of another tooth resorption decrease, or is there not enough scientific evidence to know?
So unfortunately, it doesn't necessarily mean it's decreased. It can totally happen again. So just because it happened once doesn't mean it's not going to happen again in the future, unfortunately. So that's where having those yearly exam and checkups are very important.
Okay, great. This is good to just reinforce what kind of diseases can be caused by dental tartar, dental plaque.
So yes, so there's some studies that haven't shown veterinary medicine that it can necessarily cause some changes. We don't necessarily know exactly what, to the heart, to the kidneys, to the lungs per se, but we rarely see that inflammation or infection of the heart, lungs, or kidneys just because it's coming from the mouth. There's usually another reason.
Okay, great. Is it effective to use your fingernail to scrape any plaque off your dog's teeth when brushing or using gel? Our dog tries to fight the toothbrush every time.
I think don't use your fingernail. I don't think you want that plaque and tartar underneath your nails. I'd say use a wipe. Use the wipes like the MaxiGuard wipes. Use the gel. I know it's not toothbrushing, but if that's all you can do, better than nothing, and then coming in for that anesthetized procedure, because there's no way you're going to get it off with your fingernail per se. Maybe you'll get like a good kind of anchorage point, but I would avoid against it.
Okay. We had someone saying that the dog in your video they're saying is a paid actor. They think that it is.
I will say come out of a procedure, but also even before that, he's a really good dog. Like he will just sit there and let me do anything. So I know it wasn't like a small little dog. Maybe next year I'll have an example of that. But I think closing that mouth in your small breed dogs really does help. I know it sounds strange, but they're not going to hurt. You're going to get those cheek sides of the teeth, and you're not going to be fighting them as much in most instances.
Okay, great. My dog is a small to medium puppy, aggressive chewer, and I guess that the only thing that appears to last for, I guess they swallow the chew too quickly to be effective. Mm-hmm. So any thoughts on that? A bigger one or just?
Yeah, if they're going to swallow it, don't
bother.
No diet, no treats. I would say do the wipes, do the adjunct, but again, toothbrushing, try it. I swear it works. It's going to work. Do it frequently.
Okay. A multi-basset hound owner have experienced the overbite issue you mentioned, which involves a hole in the upper jaw, a connection with the nasal cavities. Can you explain further, as I didn't understand the cause of the problem?
Of the fistula?
Overbite, fistula, yeah.
So when there's a fistula, so it usually occurs because there is periodontal disease. So again, it's not only the tooth that's related, it's your gum tissue and that underlying bone. And so what probably would have, or maybe what has happened is that tooth that was normally there has fallen out maybe on its own. And that sometimes that gum tissue will close up on its own, and that tooth fell out because of periodontal disease, but sometimes it will stay persistently open. And so I'm not sure if that answered your question, but that is why that occurs, and it's all because of that periodontal disease.
Okay, great. I know we had a question earlier about using baking soda, and then we have a question now about charcoal toothpaste, but yeah, no.
Yeah, so I know we talked about charcoal. Charcoal doesn't really do much, to be honest. There's no studies about charcoal in veterinary patients right now, so I'd say forget about it. Baking soda, again, it's a good supplement, it's a good adjunct, but I don't know if it really does anything, to be honest.
Mostly it's the mechanical action to it, right? So,
okay. The products I talked about with the added ingredients to it, like the enzymes, really do help.
Okay. We have several questions just to reinforce again with the senior dogs undergoing, anesthesia. Mm-hmm. You talked about the sealant, in some dogs, I guess, but just what can you do for senior dogs' dental health who's 15 and at risk for going under anesthesia?
Yeah, so again, that's a discussion to be had with either us or your primary veterinarian. It really, I don't think age is the biggest factor. I think it's what kind of underlying other diseases does your pet have. So heart disease, kidney disease, is it rampant and out of control? Is it somewhat controlled? If it's fully controlled, what stage of the heart disease it is? And that's a full discussion we have, and whether or not the oral hygiene or health in the mouth that when we look at exam is indicated to even going forward to doing a dental procedure. And also at 15, we do have to recognize the age of our pets, right? So if they're hitting the older ages, their life expectancy isn't as long as us. So we will have that discussion with you. It's very individually based. But if it is like an emergency, there's a tooth root abscess, it's decreasing that pet's quality of life, we have to take it out, we will do it. And we have anesthesiologists, luckily, here at a specialty hospital that we can help with.
Okay, great. We have many people saying how wonderful this presentation was, so informative. So, and thank you for that. Okay, well, I think with that, we will end this one, and we look forward to your next presentation, hopefully. And yeah, thank you so much, Dr. To. This was really wonderful and comprehensive. We're very happy to have you at AMC and with us tonight. Thank you, Kimberly, for doing such a great job organizing our events. Just a reminder to everyone, our next event, Congenital Heart Disease, will be March 15th at 6 p.m. You can register for that on our website, and we'll have the link in the newsletter that goes out tomorrow night. Thank you again, Dr. Cho, and thank you, everyone, for spending part of your evening with us tonight, and have a great night. Bye-bye. Thank you.
Good night, everyone.